Hello, everyone, and thank you for joining today's Clinical Education Series presentation. Today, we will review Relexxi, a once-daily methylphenidate hydrochloride extended-release tablet, and discuss how it may support individualized dosing for our patients with ADHD. This session will focus on indication, Osmodex delivery technology, dosing and administration, safety considerations, and provider-facing access resources. My name is Shannon Thompson, and I'm the Director of Pharmacy Services here at Genoa Healthcare. I lead enterprise-wide pharmacy programs that improve patient care, operational performance, and financial outcomes. I work across multiple functions to turn strategy into scalable solutions, optimize service delivery and management, and lead high-performing teams that drive measurable impact across the organization. We have several points today that we will review during the presentation. First, we will review the clinical challenge in current ADHD treatment. Next, we will review many components of Relexxi, including its mechanism of action, dosing, and administration. We will review clinical evidence and pharmacokinetics of Relexxi and understand its safety and tolerability, as well as key warnings and monitoring parameters. We will end today's presentation with patient access and provider resources. ADHD management often requires careful titration to find a dose that provides meaningful symptom control while maintaining tolerability. When available strengths do not match a patient's clinical need, providers may have less flexibility during dose optimization. Access and affordability can also affect whether patients are able to start and stay on therapy. This video provides a brief overview of how Relexxi uses Osmodex drug delivery technology. The first few minutes of this video review the drug delivery technology. As you watch, focus on how the immediate release layer and osmotic controlled extended release layer work together to provide controlled delivery throughout the day.
An extended-release methylphenidate formulation is indicated for the treatment of ADHD. Please stay tuned for the full important safety information, including boxed warning, at the end of this video. Once daily Relexxi is available in 7 dosing options, including 45 mg and 63 mg in between strengths. The wide range of strengths provides the option to more gradually increase or decrease Relexxi in 9 mg increments to achieve the lowest effective dose for ADHD symptom management. The innovative Osmodex drug delivery technology uses osmotic pressure to deliver methylphenidate at a controlled release rate throughout the day. An immediate release drug layer dissolves within 1 hour of administration. Meanwhile, a rate-controlling semi-permeable membrane regulates water entry into the tablet core. As water enters the semi-permeable membrane, the osmotic push layer expands, pushing methylphenidate through a laser-drilled orifice. This is the process by which Osmodex drug delivery technology delivers methylphenidate at a controlled rate throughout the day. Studies demonstrate that Relexxi's Osmodex drug delivery technology provides reliable and consistent methylphenidate delivery. The initial release causes a rapid rise in plasma concentration and maintains therapeutic drug levels during the critical 7 to 12-hour post-dose window. The Osmodex drug delivery technology allows the immediate release drug layer to provide patients with rapid symptom relief, while the extended release drug layer provides continued symptom relief. When combined with 7 dosing options, Relexxi offers the ability to individualize symptom management for each patient's unique needs. Indication and important safety information, including boxed warning. Indication: Relexxi is a central nervous system (CNS) stimulant indicated for the treatment of attention deficit hyperactivity disorder (ADHD) in adults up to the age of 65 years and pediatric patients 6 years of age and older. Relexxi is not recommended for use in children under 6 years of age, as higher plasma exposure may lead to a higher incidence of adverse reactions. Warning: abuse, misuse, and addiction. See full prescribing information for a complete boxed warning. Relexxi has a high potential for abuse and misuse, which could lead to the development of a substance use disorder, including addiction. Misuse and abuse of CNS stimulants, including Relexxi, can result in overdose and death. Before prescribing Relexxi, assess each patient's risk for abuse, misuse, and addiction. Educate patients and their families about these risks, proper storage of the drug, and proper disposal of any unused drug. Throughout treatment, reassess each patient's risk and frequently monitor for signs and symptoms of abuse, misuse, and addiction. Relexxi is contraindicated in patients with known hypersensitivity to methylphenidate or other components of Relexxi. Relexxi is contraindicated in patients with concurrent treatment of monoamine oxidase inhibitor, MAOI, or using MAOI within the preceding 14 days. Risks to patients with serious cardiac disease. Avoid use in patients with known structural cardiac abnormalities, cardiomyopathy, serious cardiac arrhythmias, coronary artery disease, or serious cardiac disease. Increase blood pressure and heart rate. Monitor blood pressure and pulse. Monitor all Relexxi-treated patients for hypertension and tachycardia. Psychiatric adverse reactions. Prior to initiating Relexxi, screen patients for risk factors for developing a manic episode. If new psychotic or manic symptoms occur, consider discontinuing Relexxi. Priapism. If abnormally sustained or frequent and painful erections occur, patients should seek immediate medical attention. Peripheral vasculopathy, including Raynaud's phenomenon. Careful observation for digital changes is necessary during Relexxi treatment. Further clinical evaluation, for example, rheumatology referral, may be appropriate for patients who develop signs or symptoms of peripheral vasculopathy. Long-term suppression of growth in pediatric patients. Closely monitor growth, height, and weight in pediatric patients. Pediatric patients not growing or gaining weight as expected may need to have their treatment interrupted. Gastrointestinal obstruction. Avoid use with pre-existing GI narrowing. Acute angle closure glaucoma. Relexxi-treated patients considered at risk for acute angle closure glaucoma, for example, patients with significant hyperopia, should be evaluated by an ophthalmologist. Increased intraocular pressure, IOP, and glaucoma. Prescribe Relexxi to patients with open-angle glaucoma or abnormally increased IOP only if the benefit of treatment is considered to outweigh the risk. Closely monitor patients with a history of increased IOP or open-angle glaucoma. Motor and verbal tics and worsening of Tourette syndrome. Before initiating Relexxi, assess the family history and clinically evaluate patients for tics or Tourette syndrome. Regularly monitor patients for the emergence or worsening of tics or Tourette syndrome. Discontinue treatment if clinically appropriate. Drug interactions. Concomitant use of monoamine oxidase inhibitors, MAOIs, and CNS stimulants can cause hypertensive crisis. Potential outcomes include death, stroke, myocardial infarction, aortic dissection, ophthalmological complications, eclampsia, pulmonary edema, and renal failure. Do not administer Relexxi concomitantly with MAOIs or within 14 days after discontinuing MAOI treatment. Relexxi may decrease the effectiveness of drugs used to treat hypertension. Monitor blood pressure and adjust the dosage of the antihypertensive drug as needed. Concomitant use of halogenated anesthetics and Relexxi may increase the risk of sudden blood pressure and heart rate increase during surgery. Avoid use of Relexxi in patients being treated with anesthetics on the day of surgery. Combined use of methylphenidate with risperidone when there is a change in dosage of either or both medications may increase the risk of extrapyramidal symptoms, EPS. Monitor patients on Relexxi for signs of EPS with concomitant use of risperidone with associated changes in dosage. You may report side effects to Vertical Pharmaceuticals LLC at 1-800-444-5164 or to the FDA at 1-800-FDA-1088. Please see full prescribing information, including boxed warning, at relexxi.com/PI or scan here.
Relexxi is a central nervous system stimulant indicated for the treatment of attention deficit hyperactivity disorder in adults up to age 65 and pediatric patients 6 years of age and older. It is administered orally once daily in the morning and is available in 7 extended-release tablet strengths. Relexxi uses Osmodex drug delivery technology. The immediate release layer dissolves within 1 hour, while osmotic pressure gradually delivers methylphenidate through a controlled release mechanism. This supports delivery throughout the day using the same technology across all 7 strengths. Relexxi is taken once daily in the morning with or without food. Tablets should be swallowed whole with liquid and should not be chewed, divided, or crushed. Dosing should be individualized based on clinical response and tolerability, with adjustments at weekly intervals as described in the prescribing information. Relexxi is available in 18, 27, 36, 45, 54, 63, and 72 milligram strengths. The 45 milligram and 63 milligram strengths provide additional titration options that may help address dose gaps when a provider is trying to identify the lowest effective dose. The full prescribing information and provider resources include clinical and pharmacokinetic data supporting Relexxi use in ADHD. Provider-facing materials describe symptom relief within an hour and maintenance throughout the day. Clinicians should review the prescribing information for complete study designs, endpoints, and safety information. Relexxi carries a boxed warning for abuse, misuse, and addiction. Before prescribing, providers should assess each patient's risk and continue monitoring throughout treatment. Safety considerations include cardiovascular monitoring, psychiatric adverse reactions, growth monitoring in pediatric patients, and visual disturbance risks described in the prescribing information. Key monitoring considerations include assessing risk for abuse, misuse, and addiction, evaluating for cardiac disease before initiating treatment, monitoring blood pressure and heart rate, and reviewing contraindications such as concurrent MAOI treatment or MAOI use within the preceding 14 days. Access resources on the Relexxi website include a savings card for eligible commercially insured patients and a MedFinder pharmacy locator. Providers should continue to confirm product availability and coverage using standard pharmacy benefit workflows. Thank you so much for tuning in to today's monthly educational series presentation. If you have any questions on today's presentation, please feel free to reach out to me at my email address listed on the slide. You can also find previous educational presentation recordings on our Genoa YouTube channel at www.genoahealthcare.com/center-partner-resources. Thank you and have a great day.